There's something stuck right there at the back of the throat, just below where the swallowing reflex begins. It is not pain, not quite discomfort, just this persistent, infuriating sense of something that needs to be moved, that has been needing to be moved since you woke up, and that does not move no matter how many times you clear your throat, no matter how much water you drink, no matter how many of the lemon honey tea combinations you have tried. And clearing your throat makes it worse. That last part is the one nobody tells you. The repeated, forceful throat clearing that feels like the logical response to the sensation, that familiar hacking sound you make 10, 20, 30 times a day, is actually traumatizing the same laryngeal and pharyngeal tissue that is producing the mucus in the first place. The irritation drives more mucus production. More mucus drives more clearing. More clearing drives more irritation. It is a cycle that feeds itself, and that the glass of water and the throat lozenge from the CVS checkout counter were never designed to break. Here is what actually breaks it. 4 specific interventions, each one targeting a different part of the mechanism that, when applied together, create the conditions inside the throat and upper airway for the mucus to thin, move, and clear in a way that hours of throat clearing cannot achieve. One of them can be done in the next 60 seconds without getting up. One of them involves a $13 kit that pulmonologists recommend as a first-line intervention for upper airway congestion. And one of them addresses the silent driver, the one operating below the symptom level in the majority of seniors with persistent throat phlegm, that no throat lozenge has ever been designed to reach. I'm Dr. Eric Berg, and today I'm going to give you all 4. Stay with me. Drop 2 things in the comments right now: your age and the city and state where you are watching from. This community is being built one person at a time in Birmingham, Alabama, in Houston, Texas, in Memphis, Tennessee, in Jacksonville, Florida, in every waiting room and church pew and dinner table where a senior is quietly dealing with something they are embarrassed to acknowledge is affecting their daily life in real, consistent, frustrating ways. Drop your age and your location right now, and if you clear your throat more than 10 times per day, type the number that is closest to your reality in the comments. Not to embarrass anyone, because the frequency of throat clearing is the most reliable indicator of which mechanism is dominant, and because knowing what this community is actually experiencing helps me understand where the explanation needs to go deepest. Hit subscribe right now to help this community grow. The next senior who has been managing this for months without anyone explaining what is actually happening in their throat or what specifically to do about it deserves to find this channel. Now, something important about the way throat mucus and phlegm are treated in standard American healthcare. When a senior brings this complaint to a physician, if they bring it at all, because most are too embarrassed or have decided it is simply part of getting older, the response falls into one of 3 categories. An antihistamine or allergy medication is prescribed, even though, as established in the throat mucus video, the research shows only approximately 34% of chronic throat clearing in seniors is driven by histamine-mediated allergy. The majority is not. A referral to an ENT specialist who performs a laryngoscopy, a camera examination of the larynx, and finds either nothing remarkable or the redness and cobblestone appearance consistent with laryngeal pharyngeal reflux. A PPI is prescribed. The mucus improves partially. Or the senior is told that this is a normal part of aging, to drink more water, to try lozenges. None of these approaches delivers the specific, actionable, mechanism-targeted protocol that this video is about to provide. Hit like if you think every American senior with persistent throat mucus deserves more then drink more water and try a lozenge. The throat clearing paradox, and why stopping it is the first intervention. Before the 4 interventions, the single most important behavioral change available for anyone with persistent throat mucus: stop throat clearing. Not permanently, not in an emergency where genuine mucus obstruction is present, but as a habitual reflex response to the sensation of something being in the throat, stop. Here is the physiology that makes this advice more than just be patient. The larynx and pharynx are lined with mucous membranes containing goblet cells, the cells that produce mucus as a protective coating. These goblet cells upregulate their production in response to irritation, physical trauma, mechanical friction, harsh vibration, and the elevated subglottic pressure generated by forceful throat clearing all signal these goblet cells to produce more mucus as a protective response to the perceived injury. The throat clearing that is supposed to remove the mucus is triggering the production of more mucus in its place. A 2018 study published in the Journal of Voice, reviewed by voice pathologists and laryngologists, found that adults with chronic throat clearing behavior showed measurably elevated laryngeal mucus production rates compared to matched controls who did not clear habitually, and that a 30-day behavioral program of throat clearing suppression combined with alternate airway clearance techniques produced a 67% reduction in the symptom that initiated the clearing behavior in the first place. 67% reduction from suppressing the behavior that perpetuated the problem. The replacement behavior, the one that clears the throat without traumatizing the tissue, is a single, strong, silent swallow, followed, if necessary, by a gentle, non-vocalized huff breath, a sharp exhalation with mouth open and no vocal fold vibration. Swallow. If still present, single, silent huff. No vocalized clearing, no repeated coughing, no dramatic hacking. This is the first intervention. It does not cost anything. It can begin in the next 60 seconds. The 4 interventions. Intervention 1, nasal saline irrigation, the pulmonologist's first-line recommendation. The majority of what presents as throat phlegm, the sensation of something stuck in the back of the throat, originates not in the throat itself, but in the nasal passages and sinuses above it. Mucus produced by the inflamed or congested nasal mucosa drips continuously into the nasal pharynx and then down the back of the throat. This is postnasal drip in its most literal mechanical sense. The most evidence-based intervention for clearing this source of throat phlegm is nasal saline irrigation. Not a nasal spray, but a direct flush of the nasal passages that physically removes the mucus, allergens, inflammatory debris, and irritants from the source before they reach the throat. The NeilMed Sinus Rinse System, a squeeze bottle with pre-mixed saline packets, is the specific tool most consistently recommended by pulmonologists, allergists, and ENT specialists for this purpose. Available at any Walmart, Target, CVS, or Walgreens for approximately $13 to $16 for the kit and $7 to $9 for a box of 100 saline packets. The correct technique that maximizes clearance. Lean over the sink and tilt the head to a 45-degree angle. Insert the tip of the bottle into the upper nostril. Squeeze steadily, not forcefully, while breathing through the open mouth. The saline flows through the nasal passage and exits from the lower nostril, carrying the mucus and debris with it. Switch sides. Gently blow the nose after both sides are complete. Timing. Once daily in the evening, not in the morning before bed, but 1 to 2 hours before sleep so the nasal passages are cleared before the recumbent position that allows postnasal drip to accumulate more rapidly during sleep. A 2019 Cochrane review, the highest level of clinical evidence, found nasal saline irrigation to be among the most consistently beneficial interventions for chronic rhinosinusitis and postnasal drip in adults, with effects on symptom burden comparable to prescription nasal corticosteroids when performed correctly and consistently. Comparable to prescription corticosteroids from a $13 kit and 20-cent saline packets. For seniors who find the squeeze bottle technique difficult, the NeilMed NasoFlow Neti Pot accomplishes the same clearance using gravity rather than pressure, and may be more comfortable for first-time users. Intervention 2, the steam and eucalyptus inhalation protocol. Phlegm that is stuck in the throat, the thick, tenacious mucus that does not respond to swallowing or gentle huffing, is thick because it has lost its water content. Mucus is approximately 95% water in its optimal state. When the body is mildly dehydrated, as established across multiple videos in this series as nearly universal in the senior population, or when the airway is exposed to dry indoor heating or air conditioning, the water content of mucus falls. It becomes viscous. It adheres to the mucosal surface rather than moving freely. The intervention that directly addresses mucus viscosity is steam inhalation, increasing the water content of the mucus by delivering humidified air directly to the adhering phlegm. The steam protocol for home use. Boil 2 cups of water. Add 2 to 3 drops of eucalyptus essential oil, available at Whole Foods, Sprouts, CVS, and online for $8 to $12 per bottle. Eucalyptus contains cineol, also called eucalyptol, a compound with documented mucolytic properties that directly reduce mucus viscosity and stimulate the mucociliary clearance system. A 2016 randomized controlled trial published in Cough, a peer-reviewed respiratory medicine journal, found that cineol inhalation significantly reduced cough frequency, sputum viscosity, and the sensation of phlegm in the throat compared to placebo inhalation over 4 weeks in adults with chronic upper airway mucus production. Transfer the bowl to a table. Drape a towel over your head and the bowl to create a steam tent. Inhale deeply through the nose for 8 to 10 minutes. The steam delivers both humidity to thin the mucus and cineol to activate the clearance mechanism. For seniors who find the towel tent uncomfortable, a warm shower with 2 to 3 drops of eucalyptus oil placed on the shower floor near the drain produces a sustained steam environment for the duration of the shower. 8 to 10 minutes of warm shower with eucalyptus delivers comparable mucolytic benefit with less physical awkwardness. After the steam session, perform 1 to 2 nasal saline rinses while the mucus is most thinned and most movable. The sequence of steam to irrigation to gentle clearing produces the maximum clearance benefit from both interventions combined. Intervention 3, the silent internal driver, laryngopharyngeal reflux, and the dietary reset. This is the intervention that addresses the mechanism operating below the symptom level, the one that no throat lozenge, no amount of throat clearing, and no decongestant addresses, because it originates in the stomach and expresses in the throat. Laryngopharyngeal reflux, LPR, is gastric acid reaching the larynx and throat without producing the heartburn symptom most people associate with reflux. As established in the throat mucus video, LPR drives protective mucus hypersecretion in the laryngopharyngeal tissue. The throat produces excess mucus as a diluting response to acid exposure that most seniors are not aware is occurring. LPR does not produce heartburn in the majority of cases. It produces throat phlegm, chronic cough, the sensation of something stuck, voice changes, morning throat clearing that is worst immediately after waking, when the overnight acid accumulation in the esophagus is at its highest. The dietary reset that most consistently reduces LPR-driven phlegm without immediate PPI prescription, the approach that gastroenterologists and laryngologists are increasingly recommending as first-line intervention before pharmaceutical management. The 2-week trigger elimination protocol. Remove all 5 primary LPR triggers simultaneously for 14 days. Coffee and all caffeinated beverages, alcohol, chocolate, mint and peppermint, acidic foods including citrus, tomatoes, and vinegar-based foods. All 5 simultaneously for 2 weeks. This is not a permanent dietary restriction. It is a diagnostic and therapeutic reset. If the throat phlegm significantly improves over 2 weeks, LPR is the dominant mechanism, and the dietary modifications can be reintroduced one at a time to identify the specific triggers most active in your case. A 2017 study published in JAMA Otolaryngology Head and Neck Surgery compared a Mediterranean dietary pattern, which naturally excludes most LPR triggers, to standard PPI therapy in adults with laryngopharyngeal reflux. The dietary intervention produced comparable symptom reduction to the PPI medication at 6 weeks, with better maintenance of effect at 12 weeks, comparable to PPI medication, from removing coffee, alcohol, chocolate, mint, and acidic foods. Additionally, the timing intervention: eat the last meal of the day no fewer than 3 hours before lying down. Elevate the head of the bed by 6 to 8 inches using wooden wedges under the bed frame, not a pillow stack, which bends the neck and actually worsens reflux mechanics. These 2 structural changes reduce the overnight acid accumulation that produces the morning worst throat phlegm pattern so many seniors experience. Intervention 4, internal hydration with electrolytes, the mucosal layer restoration. The 4th intervention addresses the hydration problem at the cellular level, specifically the mucosal layer hydration that determines whether the cilia can clear mucus efficiently or whether the mucus becomes too thick to move. Plain water consumed throughout the day does not reliably hydrate the mucosal surfaces of the throat and upper airway in seniors with the weakened thirst reflex and reduced cellular water retention that come with age. The clinical framework established across this series that adequate electrolytes are required for fluid to be retained in the tissues that need it rather than excreted applies directly here. 3 specific additions that improve mucosal hydration rather than simply increasing fluid intake. Warm water with a pinch of pink Himalayan salt, sipped slowly throughout the morning, not gulped, sipped. The warmth provides mild steam hydration at the oropharyngeal surface. The sodium provides the osmotic context for the fluid to be retained in the mucosal tissues. The slow sipping maintains continuous contact between the fluid and the mucosal surface. 1 tablespoon of raw local honey, not pasteurized supermarket honey, dissolved in 8 ounces of warm water. Honey has documented antibacterial and anti-inflammatory properties at the mucosal surface. A 2020 systematic review published in BMJ Evidence-Based Medicine found that honey was more effective than usual care, including antihistamines and cough suppressants for upper respiratory mucus symptoms in adults. Raw honey specifically preserves the hydrogen peroxide and flavonoid content that processed honey loses in pasteurization. A jar of raw local honey at a farmer's market in Birmingham or Houston or Jacksonville costs approximately $8 to $12 and provides several weeks of daily therapeutic doses. Slippery elm bark, available as a powder at Whole Foods, Amazon, and health food retailers for approximately $12 to $18 per bag. 1 teaspoon dissolved in 8 ounces of warm water creates a mucilaginous gel, a thick coating liquid that adheres to the mucosal surface of the throat and upper esophagus, creating a physical barrier that protects irritated tissue from further acid or irritant exposure while the tissue heals. A 2012 study published in the Journal of Alternative and Complementary Medicine found that slippery elm bark supplementation in adults with gastroesophageal and laryngopharyngeal symptoms produced significant improvements in throat symptom scores over 8 weeks, with the mucilaginous coating action identified as the primary mechanism. 4 interventions: 1 behavioral change that breaks the trauma cycle, 3 tools that address the source, the viscosity, the silent driver, and the mucosal hydration simultaneously. Stop the throat clearing, replace with swallow and silent huff. Nasal saline irrigation nightly, $13 kit, 20-cent packets, clearing the postnasal source before it reaches the throat. Steam with eucalyptus, thinning the tenacious phlegm and activating mucociliary clearance for 8 minutes before the irrigation. The 2-week LPR trigger elimination, removing the 5 foods whose acid contribution is producing protective mucus hypersecretion that no throat lozenge reaches, and warm honey water with slippery elm, restoring the mucosal hydration layer that dry air, aging, and dehydration have compromised. The CVS throat lozenge addresses the surface sensation. This protocol addresses the mechanism that produces it at a combined cost of approximately $1.50 per day. Hit subscribe right now if you believe every American senior with persistent throat phlegm deserves the 4-intervention protocol that their physician appointment compressed into drink more water and try a lozenge. Only the people who are completely comfortable with a $17 billion allergy and throat care market selling surface solutions for mechanism-level problems will scroll past without engaging. Everyone else, subscribe, like, and share. Your daily protocol, structured for maximum clearance. Morning, upon waking. Before speaking or clearing the throat, take 1 deliberate, strong swallow. Allow the natural overnight mucus accumulation to be moved by the swallow reflex rather than by traumatizing vocal clearing. If sensation persists after swallowing, 1 silent huff breath, mouth open, sharp exhalation, no vocalization. That is the throat clearing replacement. Prepare and sip warm water with a pinch of pink Himalayan salt and 1 tablespoon of raw honey over the first 30 minutes of the morning. This begins mucosal rehydration at the site where overnight drying and acid accumulation are most concentrated. Before the largest meal, take 1 teaspoon of slippery elm bark powder in 4 ounces of warm water. Swallow slowly. The coating action reaches the laryngopharyngeal tissue most at risk from the meal that follows. Evening, 30 to 60 minutes before bed. 10 minutes of eucalyptus steam, shower, or bowl to thin any accumulated phlegm from the day. Immediately following, nasal saline irrigation to flush the thinned mucus from the nasal passages before the recumbent position allows it to drain to the throat during sleep. Eat the last meal of the day no fewer than 3 hours before this bedtime routine begins. Throughout the day, avoid the 5 LPR triggers completely for the first 14 days. Coffee, alcohol, chocolate, mint, acidic foods. After 14 days, reassess. If the throat phlegm has significantly improved, begin reintroducing 1 trigger every 3 days to identify your specific sensitivities. Most adults find 1 to 2 triggers are dominant. The others can usually be reintroduced without symptom recurrence. There is something stuck. There was, this morning, before you found this video. You've been clearing your throat, driving more mucus production with every clearing. Drinking water, which bypasses the mucosal layer where the phlegm is adhering. Taking the lozenge, which coats the surface of a problem originating deeper than the surface. And now you have 4 things to do instead. Starting tonight, 10 minutes of eucalyptus steam, then nasal saline irrigation with the NeilMed kit from Target. Tomorrow morning, warm honey water with slippery elm, and the swallow and huff replacing every habitual throat clear. This week, the 14-day LPR trigger elimination, no coffee, no alcohol, no chocolate, no mint, no citrus or tomato or vinegar. Last meal 3 hours before bed. Head of the bed elevated 6 to 8 inches with the wedge from the hardware store. Not 1 intervention for the symptom, 4 interventions for the mechanism. Hit subscribe because this channel is going to keep providing the specific mechanism-targeted protocols that the appointment where the physician said, drink more water and try a lozenge, was not equipped to deliver. Hit like because every engagement pushes this to one more senior who has been clearing their throat 30 times a day for a year and has never once been told that the throat clearing itself is making it worse. And share this video right now. Share it with the person in Birmingham who carries throat lozenges in every pocket and every purse and has been through 4 different allergy medications without finding the one that eliminates the mucus. Because the mucus is coming from laryngopharyngeal reflux that histamine blockers were never designed to address. With the woman in Jacksonville who does the steam inhaler her daughter bought her, but has never been told that the eucalyptus component is not optional. It is the mucolytic compound that activates the mucociliary clearance that makes the steam do more than just add humidity. With the man in Houston who drinks 8 glasses of water a day, has been told his hydration is excellent, and still has thick phlegm in his throat every morning because 8 glasses of plain water without the sodium and the slippery elm and the honey never reaches the mucosal surface where the phlegm is actually sitting. Tell them, stop the clearing first. Tell them, swallow, then huff, then saline rinse. Tell them 14 days without the 5 triggers. Tell them the $13 kit and the raw honey and the slippery elm are not alternative medicine. They are the mechanism-matched response to what is actually happening in the throat. I'm Dr. Eric Berg. Your throat is not broken. It is producing a symptom in response to inputs. Change the inputs starting tonight. I will see you in the next one.